Back pain. It's one of the most common reasons people miss work, but it's also the second most common reason for visits to the doctor's office. Yet many chronic back pain sufferers don't get the treatment they need because of one word, and that's surgery. But now there is new hope and a new option. Spine surgeon Dr. Michael Hennessy of Renova Spine Care is here this morning, and he brought one of his patients along, Mr. Charles Stevenson. Guys, welcome to GMT. Good to see you.
Thank you.
All right, so we've heard so much about minimally invasive procedures, but this one is actually called micro-invasive. I'm curious, what is it, and what kind of back and neck problems does it treat?
So, Carrie, you're right. We've been hearing about minimally invasive procedures for some time now, but just like other technologies and other fields where, say, 10 years ago, what would consider to be cutting edge then, just like now, what is considered cutting edge is way advanced, and that's really what we're referring to when we say when we use the term like AccuCision for our AccuCision technique, because what may have been considered minimally invasive, let's say 10 years ago, is kind of old school. Now we're talking about more micro-invasive, where it's kind of gone to the next level. Yeah,
we love that. It's new cutting technology. How exactly does AccuCision differ from the traditional spine surgery or even other minimally invasive procedures?
Well, the real thing you have to understand, when we're talking about spine surgery in the past, open treatment, while is still a tried and true method, is much more invasive in the sense that typically longer incisions, and that involves dissecting muscle tissue. What that means, though, is that it can involve getting increased pain, increased bleeding, increased complications, increased duration of time in the hospital, all of these such things. When we're talking about using AccuCision, the real goal is to minimize or even prevent any sort of damage to the collateral structures. So that way we don't injure the muscle, we don't injure the nerves, and the patients are back home, sometimes even the same day, and obviously dramatically increases their recovery in terms of just speeding up them getting out of the hospital, or like I say, even getting home the same day.
Yeah, a lot of advantages there and benefits. Charles, let's focus our attention to you. What prompted you to come and seek out Dr. Hennessy's help?
Well, it originally began with pain primarily around my hamstring. I do a lot of work on the computer. I'm secretary of the Dallas football officials, enter a lot of data on the computer. Thought it maybe was just a bad chair or something, but eventually it spread into my calf and then even into my other legs. I was having pain in both legs. Finally got to the place where anytime I would stand erect, there's a possibility of my left foot falling asleep.
Oh no, it sounds debilitating. It really does. So you had the AccuCision procedure done. What was that like for you, and then what has life been like for you since then?
Well, everything was great. I had the surgery done. First time I stood up, then I knew that the pain was gone, because I've had no leg pain at all since it was over with. And like he said, it's a short recovery time. I was able to return to what I was doing at work, and thing I told him is I need to get back to be able to play golf.
Of course.
And so I've done that.
Yeah.
Problem is, the good news is I'm playing golf. Bad news, I'm not playing any better.
Well, you have to go out and practice some more, right? We're glad you're feeling better. So, so many people out there suffering with back pain, they want to know if they're a good candidate. So who's a good candidate for this type of technique?
Well, that's probably the best question of all, and really you have to understand that every patient that we see, we have to approach on an individual level, and many times patients don't even need surgery for this. It's, we'll try some of the more conservative measures first, such as physical therapy, sometimes even injections, but in the end, if those things don't work, that's when we really have to just focus their care and figure out exactly the best way to pinpoint their problem and then treat them, and frequently that does mean using the AccuCision technique.
Excellent. Thanks so much. Glad you're feeling better. Good to see you. And you can find out so much more by calling Renova Spine Care. That number is 855-4FIX-PAIN. That's 855-434-9724, or just go online at renovspinecare.com.